Once again, I want to welcome you to the OneSpot Billing podcast. I have invited Casey Squicquero back with me. If you were able to listen to the last episode we did, we discussed Medicare, credentialing, the different ways to check eligibility and benefits, and then we dug in a bit to the Medicare Advantage plan. We did feel like there were many more topics to discuss, and I know Casey spends a lot of time working with billing specialists. She does the onboarding for OneSpot, and we continue to get a lot of questions about Medicare. So we thought, why not do a second episode? We'll call it our Medicare Part 2. Casey, how long have you been doing billing for optometry practices?
For about 17 years.
Okay.
Yeah.
So there's a reason a lot of our customers are reaching out to Casey for some tips and tricks on Medicare and other things. And we kind of put a list together. I know typically we just dive into a bunch of topics, but because Medicare is such an important topic, Casey came up with a couple of ideas to discuss today. So just as a heads up, we're going to walk through some of the resources that CMS makes available, and then dig into qualified Medicare beneficiaries. And then hopefully, if we have some time, Casey's going to give us some additional tips on billing smarter and not harder.
Yeah.
So with that, Casey, do you mind digging in a little bit to some of the resources that CMS puts together to help billers figure out Medicare?
Yeah. So there are 4 resources that I use pretty often. And one of those is the Medicare Coverage Database. And that's a website on CMS's webpage. And it allows you to search up various billing policies for certain tests, rules, regulations for billing. On the website, there's a search bar. You can type in a keyword, a CPT code, or if you have a document or an article number, you could put that in there too. So that's one. And then the next one is the medically unlikely edit, or the MULE tool, or MU tool. And that tool tells you what the maximum unit of services for a single beneficiary on a single data service is allowed. So you just need the CPT code and you enter it, and it tells you, the various ways to bill it and how many units are allowed. So that's another good one. And then there's also the physician's fee schedule, and there's quite a bit of information available on this page. It's a tool that gives you your area's reimbursement for a CPT code. It also tells you if there's a global period and what the global period number of days is. It also indicates if the procedure is bilateral and requires a 50 modifier when you're billing 2 units. And it also gives an indication if the procedure is a testing that has a professional component, a technical component. There's times when office only bills for half of a procedure. So it tells you the procedure codes that have that. And then there's one last one, and that is the NCCI procedure to procedure lookup tool. And it tells you if 2 codes are able to be billed together. So if 2 codes are bundled, it indicates whether or not you can unbundle them with the 59 modifier. And it tells you if a separate payment is or isn't allowed. So yeah, those are the 4 tools that I use pretty often.
I was going to say, how often are you checking those? Pretty regularly?
Yeah, billing wise, I mean, especially if it's a procedure that, you're not billing too often, to look those up if it's a new code. Yes, I'm looking those up. The physician's fee schedule, looking those up like at the beginning of the year to see, if reimbursement's gone up or gone down, just to make sure I'm getting paid correctly.
So because I don't do billing, is this something that changes only once a year, or do these things get updated more regularly on the Medicare site?
For Medicare, it's going to get updated once a year. Well, actually, no, it listed out quarterly, but it's pretty common for those to be updated once a year. The Medicare Advantage plans, I feel like it could vary. So I would say on the safe side, to at least check them quarterly would be ideal.
Casey also shared the links for these, so we'll get those attached to the podcast. All right. Qualified Medicare beneficiaries. I know that this is something that confuses people. So what kind of tips can you give us on this one?
So I just want to start by saying what qualified Medicare beneficiaries is. So it's beneficiaries who are enrolled in Medicare Part A or B. They sometimes can qualify for Medicaid, and that Medicaid program can help them pay for their premiums, any cost share amounts, and one of those is QMB, or Qualified Medicare Beneficiaries. It's for low income beneficiaries, and it helps cover their Medicare premiums and then those cost share amounts from Medicare, like deductibles, coinsurance, copays, things like that. And just to kind of give some background on it, all Medicare suppliers or providers, they have to follow the rule. So even if you are a Medicare provider who doesn't accept Medicaid, you still are required to refrain from billing QMB beneficiaries for any of those cost share amounts. So any services covered under Part A, Part B that are considered cost share, so like that 20%. And then, it used to be even more confusing because, this could have been something that really never came up. You really just knew nothing about it. Nothing was really indicated on your remit, and that changed. So in October of 2017, there started to be a remittance, a remark code on the EOB, and it flags and says whether or not a patient is QMB, and it shows up with 3 different remark codes. So it'll show either like N781, which says that there's an deductible amount that you can't bill the patient for, and N782 is coinsurance, and then N783 is a copay. And then alongside of it, it shows a CO 209. And that basically states that per regulatory agreement, that providers cannot collect that amount from the patient.
Okay. So you mentioned seeing those codes on the EOB. Is there a way to see it? I know on the first call, we talked about little indicators on different cards. Is there a way to know in advance if somebody gets this additional benefit?
So the best way to see it, there's going to be indicators on your benefits and eligibility check. So straight on the Medicare provider's website, you should see whether or not the patient's QMB, whether or not you can bill for those deductibles and coinsurance amounts.
Gotcha. Okay. So I guess the fear would be if you see it on the EOB and you didn't bill it correctly the first time, how do you avoid that, or are there risks to getting it wrong the first time?
Yeah, I think the number one misunderstanding is that there's just providers who are like, I'm not going to, accept Medicaid, and I'm not going to, take Medicaid, therefore this situation doesn't apply to me. And that is not the case. So
if they're taking Medicare.
And that's what it follows. So it does not follow whether or not you take Medicaid. It is following the fact that you accept Medicare. And when you sign up for Medicare, you're signing up for, the condition to participate in all of the billing rules that go along with that. So if the patient is QMB and has Medicaid, even if you don't take it, you take Medicare. Therefore, you have to follow that. So not following it would be in violation of your contract.
Are there any other risks with billing it incorrectly?
Well, I mean, there is. So, if you're billing it incorrectly consistently, there's repercussions from CMS. There could be a like a direct, you no longer can bill Medicare, you kind of get kicked off of the panel, which could be a huge repercussion. If you do bill incorrectly, there is a refund policy that you have to follow. So, there'll be clear guidance on how you get that money and collect it, take it back, or give it back to the patient. There's a downward stream effect where if you send that balance to collections because the patient doesn't pay it, debt collectors are not allowed to collect that balance, under the Fair Debt Collections Practice Act. So credit bureaus have to follow the same policy. They cannot bill that patient. And then it really does come down to also like your patient calling, filing a grievance, calling and complaining, if it triggers patient complaints to Medicaid, then that's going to lead into CMS investigations and audit and really kind of expose, all your financials to CMS, so that's kind of what you're avoiding are those four steps.
Yeah. So it is obviously a very important topic, and getting ahead of it probably saves a lot of time.
Definitely pay attention to your remits, even if you have, a long Medicare remit, I always just scan the bottom of it, my remark codes. You're kind of just plugging away and posting. Before you're done, look down at the bottom, see if you see the N781, 2, or 3, or see if you see the CO, what was that, did I say? CO209 or OA209 will be at the bottom. So if you see those, scan back through all of your patients on the remit to see who it applied to.
Today's episode is brought to you by OneSpot Billing software. When a single doctor practice lost their part-time biller, AR quickly climbed past 25%. Taking billing into their own hands, the doctor turned to OneSpot and within months brought their AR down to just 5%. OneSpot gives practices the clarity and control they need to collect what they're owed. Visit onespotbilling.com/offer25 to book a demo and receive a $25 Amazon gift card. Anything else you want to share on the QMB stuff, or?
I don't think so. I'll also provide you with a link to CMS, the QMB site. There's FAQs on there. There's a lot of, I think, pretty helpful information on the website that they can review.
Perfect. Okay, let's get into some tips and tricks on Medicare billing. What do you got for us?
I think the first thing I would say is to understand your denial codes. One of the top denial codes I think you'll see with, if you're billing Medicare, you'll see a CO is a 109. So a CO 109 is stating that the patient has another primary insurance. More than likely, it's a Medicare Advantage plan. So in that case, you need to look back through what insurance cards the patient gave you. Look for any key indicators on there. Does it say Railroad Medicare at the bottom? Is there an Advantage plan? Does it have like the little Medicare indicator on the card? The other thing too, another common denial that I would say is pretty important right now is the CO16. So a CO16 denial is indicating that the claim lacks necessary information or contains billing errors that's preventing it from processing. And I would say, it's a good indicator that the MBI number, the Medicare ID number, is incorrect. And it was, I believe, April of this year. I think there was like a large Medicare, confidentiality hack, something where there was millions of beneficiaries that got new ID cards. So if you're seeing that CO16, then, look back through the Medicare portal. If you have the patient's social security number, you can look up to see what their ID number is or contact the patient and get the updated insurance information.
Okay.
Yeah, so that's one. I would say another tip that I would mention is to, if you get a denial, look back and see what the eligibility is. Look back and see what your insurance card states. Like I just mentioned, see if it says Railroad Medicare at the bottom. See if the card just indicates that there's Part A coverage and there's no Part B coverage. You know, just kind of double check yourself before just straight billing the patient. Double check those denials when they come in.
That makes sense. I would also think that would help because very often the person working on the billing isn't the person collecting the cards or taking the notes. So any amount of information that you can gather and share back saves
Correct.
time
Yes.
later if you can share that with the front desk or
That is
whoever's collecting.
that's another tip I would say, is to educate your providers, educate your staff. If you're billing a test and it comes back saying the diagnosis isn't covered, use the Medicare coverage database, look up to see, if your contractor gives you a list of diagnoses that are covered, and provide that to your provider. They can look through to see if there's something similar that they can rebill for. And then also educate your staff. Like if you're getting denials, you have to educate your staff of what they need to look out for. Show them what to look over on the card, things like that.
Yeah, in a situation like this, saying, well, that's not something I could fix doesn't really help anybody, right? Like
Yeah,
having everybody on the same page, I gotta think is the only way to make sure that you're getting paid for everything that
exactly.
you should be getting paid on. Yeah,
Yeah.
yeah. All right, other tips.
Yeah, I would say know your timely filing. Medicare is 365 days, so you have a year to file, but Medicare Advantage plans vary. So make sure that you know all of your Medicare timely filings, Advantage plan timely filings, make sure they're documented so you're getting those claims in time. Um, what else would I say? I would say then my last tip would be to scrub your claims. Before you're submitting your claims, make sure that you're scrubbing them. Make sure that you are looking for all the necessary information that's needed. Look for any payer specific requirements, any general coding guidelines. Claims, they got to have accurate patient information, provider information, payer IDs. They got to follow procedures and guidelines with certain diagnoses and modifiers, and just making sure that that claim is scrubbed the first time is going to eliminate that additional information that you have to look back to appeal the claim. It's going to save a lot of time.
Yeah, I think the concept of touch it once
Yeah,
is probably speaks very highly in billing and coding
yeah,
than just about anywhere else.
I
Maybe,
agree.
maybe not. What is the carpenter measure twice, cut once? Maybe like the opposite here. Like if you could touch it once and not
Yep.
have to touch it a second and a third time,
Time is time
save
is
the
money, so saving time is
yeah,
saving money.
yeah. I gotta think all these tips too, and looking at the stuff in advance, hopefully helps arm people so
Yep.
that when they are reviewing the claims and scrubbing the claims, I mean, I'm sure a lot of it is repetition. I know from spending time with you that it seems like there are always random things that come in because you can't just always see the same types of patients. But I'm sure a lot of it is repetition, and then it's probably the ones that slow you up the most are the more unique
Yep.
situations and patients.
That's when I would use my tools. You get that new procedure that you're billing, you get a new testing machine in the office, billing new codes, use those tools to look up all of that information, what code you're billing, see if anything's bundled, see how many units you can bill, see if there's a global period. Yeah, I think that it's all, those tools are pretty helpful.
Yeah, and they help build your knowledge base to hopefully
Exactly.
save you time later. So, all right, Miss Casey, thank
You're
you, my dear.
welcome.
If anybody has any other suggestions on topics, we have quite a few. I think I'm excited. Hopefully, you guys will be excited about some of the other ones that we have lined up. But if you have any suggestions for us, you can email them to me at cbraden@onespotbilling.com. Casey, thank you
You're
so much.
welcome. Thank you.
All right, talk to you. Bye
Okay,
bye.
bye.